There is a clear difference in resolution between the two images. This one is stationary and does not move. Now we have discussed contrast, noise, and resolution. You have noise and resolution. There is something related to quality assurance, which is quality control. Quality control or quality assurance can be considered. In fact, quality assurance is broader than quality control. Quality control is part of quality assurance, and quality assurance is part of the quality management system. In quality assurance, you test your machine with tests that are conducted daily, weekly, monthly, quarterly, and annually. For the gamma camera or the SPECT machine, I perform a test called the uniformity test daily, and I conduct a center of rotation test and a linearity test weekly. Monthly, I perform an intrinsic uniformity test along with a resolution test, and I conduct about 13 tests annually. However, when you read this, you might find yourself confused and unsure about what this means, because the text is very concise and the topic has a lot of details. I just want you all to imagine with me for a moment. Please focus with me for about 10 minutes so we can understand the topic of quality assurance. I know it might be a bit distant from you, but I will try to simplify it as much as possible. First of all, I have a crystal that detects technetium, and the technetium is taken by the gamma camera. So, I need to make sure that my device is detecting at 140 kV, right? That's normal. I'm going to inject technetium into the patient today. If I injected this patient and then tried to image them, and I found that my peak or pulse height analyzer is set to a different energy, is there a problem or not? Okay, so I perform something called a baking test, the energy resolution test. Now, the crystal itself has a photomultiplier tube on top of it. Is it possible that all the photomultiplier tubes are working with the same efficiency? What if one of these photomultiplier tubes has an issue? For example, if there is a defect in a cable, what will happen? It means that the part covering, let's assume, the photomultiplier tube is dead. In this case, will this part of the photomultiplier tube see the scintillation that occurs here or not? It won't see it, right? It won't see it. So how will my image appear? This part will be off, not lit. Therefore, in this case, I want to ensure that my image or the crystal is completely uniform, so I perform something called a uniformity test. What does uniform mean? It means that all areas, all pixels, and all locations on the crystal are uniform. Operating at 100% efficiency, all parts are functioning uniformly, not just at 100%, but everything is working the same. There is no photomultiplier tube that is different from another. There are no crystals with any issues. Why is that? Because these crystals can be affected by humidity or temperature, leading to cracks or breaks. This can happen due to the conditions present and the temperature that may not be perfectly controlled in the room. This can occur if someone, for example, bumps the geometry or hits the crystal in one way or another, causing some kind of issue. So, let's see together how this matter is handled. As we mentioned, if I am using the collimator, I will now perform an extrinsic uniformity test or an intrinsic uniformity test. Every morning, the technician will come and conduct this extrinsic uniformity test and the energy resolution. How does he do this? He uses one of two methods. Either he uses something called a cobalt flat source or a cobalt sheet made of a radioactive material called cobalt-57. This radioactive material has a relatively long half-life with a T-half of 270 days, and its energy is 122 kV with an activity of 10 to 15 mC. I have a sheet that looks like this with a safety of 10 to 15 millicurie. Cobalt is placed on the surface of the collimator, and then an image of this sheet is taken. This surface covers the entire area of the collimator. Look, here is the cobalt, and here is the collimator, and here is the crystal. It covers this entire area. So what do you want to say? This is a radioactive material that I placed, and the image that should come out should look like this. It should be homogeneous. The image should look like this, with all areas having the same amount of the radioactive material. Everything should be uniform because you placed a cobalt flat source on the surface of the collimator. What am I doing, doctors? I am performing extrinsic uniformity. If I remove the collimator, I will perform intrinsic uniformity, but we will talk about intrinsic in a little while. The extrinsic test is done daily. So, how does the image look? Did you see image number what? What do you think about it? The image looks like a television picture, as we used to talk about how it eventually turns off. Your image is homogeneous, consistent in all areas, with the same color and no problems at all. Now, in image number B, you find bright areas and dark areas, bright areas and dark areas. Can you see that? Is it clear? That's a lot. 8, so this is a non-uniform flat image. There is a problem. This problem could be related to the photomultiplier tube, or it could be related to the counts you are collecting, which are not enough to give you a good image. The collection you are doing is not providing you with a good image. There might be a problem with the crystal itself needing to be redone. This is done daily at the same time. You might come to take a picture and find this white color. Can any of you guess what this color is or why it appeared? This is actually a break that has occurred, and it has appeared this way. Imagine, doctors, if we hadn't done this test and you came to take a picture of this patient, where would this artifact show up? It would show up on the images of the patient. Look, this is a picture. Imagine seeing this black spot. Now think about the explanation we provided. This black spot could be shaped like a circle. You are currently performing a uniformity test. This image appears this way. What does it mean? What kind of crystal is this? The problem is with the crystal. Everything seems fine. What you have taken on a circular shape. One of the photomultiplier tubes is defective. There is a problem with it, and it is not working. This is one of the cases. Is there a problem that is not expensive? It appeared like this. So of course, if you are coming to image a patient, and this patient, for example, is undergoing a bone scan, and this area is, for instance, the spine, it appears here as if there is a lesion present, which is not true. I am trying to show you the importance of quality control. I want to show you here with images if there is a picture. I have a lecture that I was preparing. For example, it tells you that this legend gives you real images of patients, and there was a problem with the crystal and quality control that wasn't done. Unfortunately, this is quite prevalent in our Arab countries. Quality control is often not performed. This leads to defects and issues that start to show up in the diagnosis. Unfortunately, the doctor reports the case without knowing how to clarify it, as you can imagine. In this case, he sees that there is a defect and he diagnoses it without further investigation. For instance, if there are some defects that are small, they might appear in the myocardial wall, and a part might look dim, leading him to consider that part as defective. This is not true. It results from a problem that should have been addressed, or an issue with the photomultiplier tube. If we had quality control, it would be clearer, but there are things we keep changing to identify the problem. There are indeed some things that may seem minor, but really have a noticeable impact. They genuinely affect quality, not just trivial matters. Unfortunately, next time I can bring you some images showing the effects of quality control on specific cases I have with the doctor. You need to recalibrate it again. Yes, of course, that requires calling the engineer to come and see the problem. For example, something like the photomultiplier tube needs to be replaced. Either the photomultiplier tube is changed, or we check the cable of the photomultiplier tube. It could be a case where the crystal is changed, and there's no solution for that. If the crystal is changed, there's no discussion about it. Unfortunately, the topic remains. Apologize for bringing it up.
Centiliter and BMT, or books or Twitter. Kilo accordion to me right. The video, active video. Throw your voice to the user, meaning whether it is Gaily or Technica. It is not the same. It differs. No. The thickness of the crystal should be such that if you are going to work, for example, with high energy iodine, some people use a crystal size of 5/8.
No. The crystal, if its thickness is available, it is preferable that if you are going to work, for example, with sodium iodide. Some people work with the crystal to be 5/E. The common crystal size remains a bit large, which is 3/8 inches. This is the most common. However, there are no changes in other aspects that might be somewhat related to the companies regarding the field of view of all crystals, which are, of course, sodium iodide. The material in the gamma camera is the same as the material adjusted with thallium, but the efficiency of the photomultiplier tube in the machine is related to something called dead time, which is the time during which you are recording a signal, and you have a period where you are seeing the subsequent signal. This is referred to as dead time. The longer the dead time, the more it affects you. For example, if there is a signal coming in while I am processing the current one, I won't see it. So in this case, you can expect that your count will increase rather than decrease. These are the details that differentiate the performance, such as the status of the dead time, the condition of the crystal, the number of photomultiplier tubes, and the shape of the photomultiplier tube. Of course, all these factors affect the overall resolution and the details of the imaging.
The FDG couldn't capture images of the entire university. Why is the FDG emitting 511 kilo electron volts, while the gamma camera and SPECT are talking about 364 kilo electron volts?
I can't take a picture of the whole university without a fudgy, and it came out 511 kilos for true bolt. Without a fudgy, and it came out 511 kilos for true bolt. Is that all? The gamma camera and the aspect you are talking about is 364 kilovolt. This is the maximum for sodium iodide. That's why I went from home to the CT or the FDG at home CT. Instead of using sodium iodide, I will use zinc crystal, something like PGO, which is bismuth germanate, or LISO, for example. These different types of crystals have a higher stopping power than sodium iodide and a different attenuation coefficient. Sodium iodide can stop photon energy up to 364 keV, but beyond that, you will find that the energy is too high for it to stop effectively. The attenuation will be weak for them. However, other crystals like PGO and LISO, as we will discuss in PET, can stop 511 keV, which is why we opted for PET. You calculate something called integral uniformity and something called differential uniformity. What does this mean? Integral uniformity looks at your field of view, checking the highest pixel and how much it accounts for, the lowest pixel and how much it accounts for, and each pixel and how much it accounts for. With this equation, maximum count per pixel, minimum count per pixel, maximum count per pixel plus minimum count per pixel multiplied by 100 gives you the integral uniformity. This means you are observing the uniformity across your entire field of view. As for differential uniformity, you specify a set of pixels in a certain area in a specific location. This is the integral uniformity, meaning you are observing the uniformity at the level of your entire field of view. What about differential uniformity? No, you specify a set of pixels in a certain place. The machine determines the high and low pixel values, and this high and low is considered more accurate, meaning it is more defined for a specific region, which is called differential uniformity. For example, here I want to show that I need to prepare more. You will find the field of view here, and specifically, you will see the values for the minimum and maximum in integral uniformity. You will find it at approximately 3.09%. This is the integral uniformity, and you will always find a lower value underneath it, which is clearly 1.7 as mentioned in the documentation. Why? Because you are dealing with a small area or a small region of your field of view, so the probabilities of variation between the pixels are not significant. Unlike when you are dealing with your large field of view, where there could be a high point and a low point with significant variation between them. That's why the value of integral uniformity is always higher than the value of differential uniformity. So, we have conducted the uniformity test. We learned that this uniformity test deals with the cobalt flat source. There is another method for the cobalt flat source, which uses an empty flat made of perspex, a type of plastic, where a solution of technetium is placed. If people do not have cobalt-57, they can start imaging using the same technique and method for the gamma camera and begin to see and perform the same analysis that was done. Now, for the intrinsic uniformity, what I do is remove the collimator and take a point source, using a syringe to hold a certain activity. This activity is very low, measured in microcuries, and I will place it at a distance because if I bring it close to the crystal will not see anything. Does anyone have an explanation for why this happens when we bring the point source closer? The strong crystal on the surface of the crystal won't show you. It won't give you a clear image. And moreover, furthermore, in addition, as well, if you add the source from the detector from the collimator, no, I added the collimator. If you add the source from the collimator, you will see the source. If you add the source from the collimator, you will see the source from the crystal. Will you see anything? I placed the source and adjusted the climate, and you will see the source. If I moved it a kilometer and placed the source on the surface of the detector, on the surface of the crystal, will you see anything? I still need to tell you there is nothing. Let me explain why. Weren't we just talking a little while ago about something called dead time. So, when you brought the source closer, is there anything that will cause any attenuation, like a collimator? So, is the ratio of future receptors high or low? High. So it is required for the detector to remain fast in recording the signal, right? Right. So when he can't keep up with the signal coming to him, what will happen? His dead time will increase. You know what I mean? It's as if he can't see your image. It will stop, and we won't see anything. Why? Because in simple terms, you are currently giving him successive photons, one after another, and he can't keep up, unlike where the collimator takes away a large part of the incoming photons. So he receives a signal, records it, and then goes back to what? Even if the time he has is just in nanoseconds, the counts or photons coming out are unimaginable. We're talking about millions. I mean, we're talking about 3 times 10 to the power of 10 photons per second, for example. These are very difficult numbers. So no matter how strong your detector is and how high its efficiency is, even in recording, and the time it takes for recording is fast, even though there's nothing causing attenuation, the signals are coming in at a very high speed, so he can't keep up. What happens is that the image won't be present. The image won't be present. And this is really what happens. That's why in this test, they tell you to keep the source away from the detector by about 2 meters. The distance is approximately 1 meter. So what do we test it with? We perform the same test. We conduct a uniformity test, but intrinsic. This is done monthly. And it gives you the same results and the same images, providing you with differential uniformity and integral uniformity. Of course, I have specific values to meet the specifications, meaning they must be below the limits of the specifications of this machine itself. If they exceed, this platform must undergo recalibration, or the test may be repeated. If the values are still above 3 shoulders, or above their limits, we inform the engineer to come and check where the problem is exactly. This is the Siemens device. For example, this is the integral uniformity, and this is the differential uniformity with the equations. Also, I have come out knowing that there is something called the useful field of view, and something called the central field of view. This very large square, the really big one, I call it the fall field of view. The big square, it's really big. This, I call it. The UFOV is the useful field of view, 95% of the full field. The central view is 75% of the UFOV. It calculates uniformity, integral, and differential uniformity in both fields. 75% of the useful foldable is calculated based on the uniformity in the useful and central foldable. And it calculates the integral in the useful and central, as well as the differential uniformity in the useful and central in the lobby. Okay, how was the resolution tested exactly? What do you think of this view, in your opinion? What kind of view is this, specifically, doctors? The line pairs are very clear. These line pairs, as we said, allow you to see all these line pairs with your own eyes. This is a group of line pairs, and this is another group, and this is another group, and this is another group. Can you see them all with your own eyes? Will the machine see them as you see them, or is there a difference? This is what we do. We place the quadrant bar phantom, which is called the quadrant bar phantom, on the collimator. So, I am measuring the extrinsic resolution or intrinsic resolution now, right? Then I place the cobalt flat source on it. The image that should come out is what? The image that will come out for me regarding this phantom should look like this. Okay, this is the image that came out. Can you see everything as you saw it before? Or is there a difference? There is definitely a difference. It's not the same. I, for example, as Islam, can see this group. Here, the spaces between line pairs are clear. Here the gap is a bit smaller, and here it is even smaller. But as Islam, I can't see this, yet I can see this and this and this. So I call this a qualitative assessment. I am observing the special resolution of my system, which is the smallest line pairs I can see, or the smallest space between the line pairs I can observe carefully. It tells you that the line pairs have a gap of 4 millimeters here, 3.1 here, 2.5 here, and 2 millimeters here. So your resolution is at 2.5, which is the smallest gap the machine can see between two objects. This means if you have a lesion next to another lesion, the distance between them is 2.5. Now, how can I not see the 2 millimeter distance? How will you see them as you see them now? All right, doctors, this is the quadrant bar phantom. So what about the topic of linearity? You see these lines are linear, right? They are all going straight. If you see any deviation, something going up or down, I call that non-linear. It tests the linearity of the machine in the field and the view. Are you seeing these lines as linear or non-linear? And what about sensitivity? Linearity and the special resolution that we talked about are among the tests that are conducted weekly. I mentioned uniformity, which has both intrinsic and extrinsic types, and I talked about resolution, which also has an extrinsic type. So, is there an intrinsic type? Yes, there is an intrinsic type. I will remove the collimator and place the quadrant bar phantom. But this time, I will use a point source, the same point source.